Welcome back to Your View.
Thanks for staying with us. So nurses are the backbone of any health system. Today, many nurses find themselves on the front line in the battle against COVID-19. The question is, are nurses properly equipped for these times? Joining us on the show is a family health director, lead nurse, Africa International Foundation, Julie Mogbo. Good morning, Julie.
Good morning.
Good to have you on the show.
Yes, it's nice to be on the show. How are you guys doing?
Great, great. So nurses, obviously, all over the world are really appreciated for the work they're doing, the sacrifices they're making, especially because they're amongst the first, they're the front liners people come to in hospitals. One of the worries so far is, however, is that the nurses in Nigeria, are they well equipped for their work, especially at this time? I know I have Miriam's mom works she's a nurse, one of us. Her mother works as a nurse in Plateau State. And one of the worries Miriam was always having that, Mommy, are you properly equipped? And we are just concerned. So I'd like to hear your thoughts. Do you think nurses are properly equipped going for this pandemic?
Okay, thank you very much. If we consider the severity of the pandemic that we are being faced with, especially as the figures are now rising, we will say that there is a need to do more work. I have sampled the opinion and the experiences of our nurses working in the hospitals, and from the feedback that I got, there is still a lot of work to do. I personally do not think that our nurses are well equipped to manage this. Trainings have been ongoing, but trainings need to continue, and here is the reason. The healthcare system before COVID-19 has already been shaken.
Yeah, I agree.
And COVID-19 has just revealed the severity of the gap within our healthcare system. And what we were used to before as nurses is managing. Nurses are used to either borrowing one item or the other. Nurses are used to, okay, let's do it like that. They're used to trying and getting tired of trying to get the management to do the needful, provide the normal equipment they need to use. Now, if they have been doing this for 10 years, 15 years, 18 years, we cannot expect that all of a sudden, because of COVID-19, they will just snap out of their old behavior and adopt the necessary behavior, which is preventing the infection from spreading. So we need to keep training them now and again. We need to keep training them on how to prevent themselves, on how to don and doff the personal protective equipment, on how to know what equipment to use per patient.
Okay. Let me get a few questions for you here. Go ahead.
All right. So I understand now that the risk of burnouts, because the nurses are going to be working for longer hours, and the risk of also infecting other family members, that when they are done from work, they have to go home and meet their family members without actually properly protecting themselves because they do not have all of the equipment. Is there like a form of compensation? Because a lot of nurses are worried and some are threatening to go home, according to the papers this morning. Is there like a form of compensation that is being given to encourage these people who are at the fore?
And now, compensation is one part. It still does not change the fact that they are still going to be working long hours and they still have that fear of carrying on this infection, the possibility of infecting their families. As I speak with you, there are 3 families that I know, not in Nigeria though. They are already battling with guilt because they lost their husbands. 3 nurses lost their husbands to COVID-19. Not in Nigeria, but they are Nigerian nurses. So if our nurses hear this fear will increase, the anxiety will increase. So yes, there might be palliatives in terms of financial incentives and all that, maybe insurance, that's on the side. But it's not going to prevent the stress on the individual that has to work for long hours. We have many registered nurses in Nigeria, and there are those that are currently not working because perhaps they do not have jobs or their private facilities are shut down. They need to be called up. The working hours need to be reduced. Other workers are brought in. Mind you, that not all nurses who are at the front line are fit to work. There are those that have comorbidity, those that have underlying medical concerns and are not supposed to be put in the line of the COVID fire. They are supposed to be given or assigned another duty.
But how would the government know the ones that have this problem?
The line.
Our own is the nurse. You have to have an association that will say, okay, she can't do it because she has this problem. It's not for the commissioner or somebody to know that they have the underlying problems.
Thank you for that. These, like I said, COVID-19 has revealed to us our skeleton, our cupboard of skeletons. These are systems that ought to have been put in place. You have the proper data of all those working in your facilities. So at the point where we started hearing about the COVID-19 pandemic, and when it was even declared as a pandemic, hospitals were supposed to get their nurses to update their records. If you didn't have records of those that are battling one condition or the other, that was the time to have started it at that February. So you know that, okay, when it comes to volunteering, as it is, some hospitals are doing it already, but it's done verbally. I had a conversation with an Apex nurse this morning, and I said, could this be properly documented? Let it not just be to the nurse, because a nurse will look at perhaps the incentives coming and will say, oh, this may help me. Let's not rule out the fact that money is important at this time. We know what is happening in the society. Yes. So nurses might just say this, okay, let me volunteer. It's my duty after all, and I will get more pay from it. Let it not be verbal and not alone. Let us go to a point where they have to document just in case anything happens and litigation cases arise.
As you rightly said, nobody prepared for this. What would you advise the government to give to the nurses to be able to do their work appropriately at this time?
What I'm going to advise is this. The government should identify all nursing stakeholders. Now we have those in the clinical setting, we have those in the community setting, we have those in the NGO sector. Right. Like I work with Lead Nurse Africa. What we have been doing, we've been the rallying point for all nursing associations, and we have been dishing out action points to help in fighting this pandemic. We need the government to call all stakeholders. Let the nurses be ably represented at stakeholders meetings, at discussions. We have direct contact with community people. We have direct contact with patients. Our opinion matters. The perspective, the challenges that we're facing matter. So when there are certain discussions, there must be a good representation of the nursing profession there at such meetings. That is one. Two, the incentive. There shouldn't be any form of discrepancies or disparity in the palliatives given to nurses in comparison to other medical professionals. Because I would not take it lightly personally. If other people are going to be paid a particular amount and I'm paid half of the amount, is their lives more worth? Does it have more worth than mine? If anything happens to me, is it that my family will be less affected than their family?
Right.
For those on the front line, let it be a flat amount, whatever incentive. They are not more exposed or less exposed to the infection than any other person. Right. That is true. Three, there shouldn't be rationalization of PPEs anymore. Okay. If some states are considering to mandate the use of facial masks, then what do you expect in the hospitals? So there shouldn't be rationalization. There shouldn't be one. I've gotten reports where some nurses have said, it's your life. Some nurses have been told, go and get one for yourself. That shouldn't be.
So they're made to use their own money to buy the...
Some have been told, go and sort yourself out. It's your life. It shouldn't be.
But even the police go safe. They tell them, go and buy your uniform yourself.
It shouldn't be.
Right, go ahead, Lucy.
I want to believe that you people have, the nurses have an association that speak for them in cases like this. So I'm wondering, is there any plan coming from the association now? Because the truth is the federal government, the state government cannot do everything to ensure that you have people who attend to the nurses, like psychologists and mental health practitioners, to help them, go through this phase. Because the nurses are at the forefront. They are going to be meeting a lot of these patients. They do more of the work than even the doctors. So do they have people who still cater for the people who cater for others?
Okay, so like I said, the foundation that I belong to, Lead North Africa, is a Pan-African organization.
Okay.
And we have been organizing conferences, leadership conferences, empowering nurses and equipping them with upgrading their care at the front line in their clinical setting or wherever they find themselves. We've had 2 strategy meetings 2 days ago and then yesterday. Tomorrow, which is Wednesday, we are rolling out psychotherapy intervention, which is part of our core responsibilities as nurses. Okay. And we are hoping that we will get a buy-in of the government to train the nurses at the front line in this particular intervention because, one, they need to be exposed to it daily so that their motivation and resilience level is sustained at a peak in order for them to render effective care. 2, when they are armed with this technique, they will in turn use it on their patients who come in and are scared of dying, who come in and are feeling and they don't have a bright future of the outcome of their treatment because that is what we're experiencing. Anybody who goes there would feel that they're going to die. That is what we experience in a regular hospital, let alone when you're faced with a virus like this.
I want to go ahead, Waike.
There are some tweets that maybe will make you feel happy. Nurses, this is from Andrew in Streatham. He says, nurses, a.k.a. Angels of Mercy. My mom is a retired nurse. I cover all of them, covering in the front line in the UK, Nigeria, USA, and all over the world with the blood of Jesus. Amen. Tolu Lokpe Daudu says,
COVID-19 has been Waike said.
It was in the tweet.
Go ahead.
Tolu Lokpe Daudu says, I celebrate our nurses in Nigeria, especially those in the forefront of the treating of COVID-19 patients. Please, I'd like to plead that the protection of these nurses and their families should be considered. They are the ones staying with the patients all the time.
Julie, I'd like you to answer this question. Yes, you've told us what you want from the federal government. What would you appreciate potential patients to do? Because Nigerians, we come to the hospitals without even disclosing what we've been through, our travel history. What would you like? Yes, the government have their own responsibilities. What would you, as a nurse, say to patients coming to the hospitals?
Okay, now the focus has been on the hospital, and this is the reason that I ask that the government shed the beam of light of care to other organizations. And this is what we are doing. We are interfacing with the front line. The spectrum of front line is wide. So we have the community, we have the homes, we have the community, then we have the hospital, and that's the treatment part of it. So we have the preventive front line. So now what we are doing with patients, we're telling them it's not a death sentence. If the patients are aware that care is available, treatment center is conducive, and there's a possibility of a positive outcome of you coming out, where we would have to show them incidences of people who have survived, which is actually higher now in Nigeria than the death cases. We can do that. That's part of our responsibility. And one of the things that we're asking, once we are given that platform, let's have access to these people. Let's have our freedom of movement. With our licenses, let's go into the community. We have mobilized over 300 nurses that will take this information to the people. So we can.
But Julie, Bisi said it earlier that this option might actually be more endangering other innocent Nigerians who have no business with COVID-19 virus. But if you have, yes, go ahead.
Now, I'm asking, I need to get that question clearly.
Okay, because you were saying that they need to involve other stakeholders within the treatment of COVID-19. And we discussed it earlier. And one of Bisi's points was that it's a good idea, but if we have nurses who have been in contact with those who are confirmed virus cases and then reaching out to other people, that might actually cause this to spread further, don't you think?
Okay, now, like I said, we need to define responsibilities and identify nurses that are working in certain settings. We have those that are in the hospitals. They would not have any business outside of the hospital. Then we have those who are outside of the hospital who can interface with people in the community. We cannot determine for the people where to go to for help. I said it on one program. On my street, I met a mother with her son going to the hospital. She chose where to go to. We can't control that. But if we have our nurses, foot soldiers, those that are advocates, we have advocates. That's our first responsibility as nurses, who will go on market areas, wherever, educate these people, sensitize them, teach them on how to prevent or adhere to precautionary measures and all that. Then if along the line we suspect any COVID case, we need to have a direct contact with NCDC, because one thing our license tells us is this: know where your jurisdiction ends. So we don't go beyond it. So if I'm in the preventive line, I keep it at that, preventive. I won't venture into curative. So once I see a case that needs some cure, I would refer to the necessary and appropriate quarters. So that is why we need to activate everyone. When we have a surge, my fear is this: we may not be able to handle a surge.
Right.
But
you are
always about prevention.
You are talking about yourself. Do all the nurses have this same work ethic?
Like I said, I represent Lead Nurse Africa International Foundation, and on our group, we have family nurses who have designed interventions to help non-COVID cases.
Right.
Because when the non-COVID cases arise, they want to go to the hospital for help, or they want
I
to
have to
manage
run off right
themselves,
now.
and we will have issues.
Right. Thank you very much.
We have been designing programs, and we have hundreds of nurses on our platform.
All right. I have to let you go at this time. Thank you so much for joining us this morning. We've been speaking to the Health Director, Lead Nurse Africa International Foundation. That's Julie Mogbo. Okay, that's all we can take on the show. We've learned quite a bit. It was a really intense show today. We'll see you again tomorrow. Have a fabulous day. Bye for now.
Intense, depressing.